parent is ready to hear your child has cancer, it is one of the single most overwhelming experience one can possibly face. You feel completely lonely and lost in the world. CHOC has 12 home away from home accommodation facilities close to the treatment center across South Africa. We went to find out how they help these young cancer patients to express their fears, concerns, and understand the hospital environment. Now speaking to us was Zukiswa Mukwevo.
Well, in our hospitals, all our hospitals have got psychosocial support, whereby in each and every pediatric oncology we've got social workers that are able to help and the kids there with blood preparations for procedures before they go for procedure. We're able to explain to them what is going to happen to them before they go so that they don't get scared or anything. And then with as well as the support of their parents, that always being there for them, it's more important as well.
The CHOC psychosocial team helps to make the journey a little more bearable and not so lonely. They provide entertainment and also assist those kids who miss school.
Most of our hospitals, the government hospitals, we've got schools there that sometimes the kids go to school, but if they can't, they're in treatment, the teachers go to them to do some homework, some studying with them. And also we do have some volunteers that come and assist with the kids with coloring, even the young ones, because of the young ones, the little ones, you find that they don't have anything to do, but they are here to do paintings and coloring and some knitting as well.
The earlier the kids are diagnosed, the better chances of defeating cancer.
So cancer can be a devastating diagnosis and can have a huge effect not only on the child but on the entire family. Although cancer in children and teenagers is rare, between 800 and 1,000 children under the age of 15 in South Africa are diagnosed with cancer each year. However, it's estimated that half of the children with cancer in South Africa are just never diagnosed. Yet most children cases can be treated successfully if they're detected early, and the chances of survival are as high as 77%. Now, Childhood Cancer Awareness Month is celebrated in September. Now, gold ribbons are worn to help raise awareness worldwide. So today we discuss childhood cancers, and our guests today are the head of pediatric hematology oncology at Charlotte Maxeke Johannesburg Academic Hospital, a health specialist from the Cancer Association of South Africa, or just Cancer, the communications manager at CHOC, or Childhood Cancer Foundation of South Africa, and we'll also be joined by a mother who will be sharing her story with us on her child living with a very severe childhood condition. Now, be part of the show by asking the panel some questions or simply sharing your views with us. The number to call in that case is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show ahead, coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
Township under siege, roads blockaded, and the atmosphere here remains tense. Residents want their houses damaged by the storms repaired.
Raids are coming. Who's going to repair my furniture?
Police remain vigilant.
We may never have sufficient members, but the members that we have, we are comfortable with them. We are in a position to deal with the situation.
From us also as councillors, we lack information as it's not cascaded to us.
I always say entrepreneurship are those that see opportunities where others don't.
You can't give me a bad deal. You can't cheat me. Because I'll read my own contract. I know what's going on in my contract.
But I've never been afraid of a challenge. I'm one of those people.
I didn't know the difference between my money and the business money. Whatever money that came in used to be your money. You'd go shopping, driving all these cars, and we were forgetting to pay creditors.
If we're more diligent with how we utilize our money.
So the great thing with this and my other job, being an advocate, is that in both industries I sort of own my time.
Today we're doing inner city buildings, we're doing commercial projects, and we're doing property development even within the township scale, and even now going to the extent of now even establishing offices in the States to be able to raise capital to invest in Africa.
Keep it locked to Bupilong every Saturday at 5:30.
Dr. Nonkululeko Buikutso, who is a qualified public health medicine specialist currently working in the position of clinical director at the Nelson Mandela Children's Hospital. Before being a medical doctor, during her teenage years, she received horrible news that she has cancer.
I was diagnosed with cancer in 1995 at the age of 14 years. It's called a dysgerminoma, so it's an ovarian cancer. I stayed at the time in Soweto, so I was diagnosed by, well, initially I was found by one of the GPs in our neighborhood, who then referred me to the bigger hospitals in Johannesburg, and that's where I was diagnosed.
After being diagnosed at the age of 14, Dr. Nkuli had fears, understandably so, because she didn't understand what is cancer. All she knew was that this is the end for her.
I knew about cancer was what you see on TV, that people have cancer, their hair falls off and they die. So I really didn't know much about it. In fact, when I went to go and get diagnosed, I thought to myself, is this a dream? Am I in a movie? Somebody will tell me, wake up, this is not really happening. So I really didn't know much about cancer at the time, even the type of cancer that I had, because the doctors were saying it's so rare for a 14-year-old to have a cancer of the ovary. I had no clue there was a cancer like that, because most of us hear about brain tumors or leukemias, but an ovarian cancer in a child, I had never heard of it before.
Ovarian cancer is much more common in older women, but some type of ovarian cancers, known as germ cell tumors, are more common in teens and young women. Early ovarian cancer usually does not cause symptoms, but Dr. Nkuli had horrible symptoms.
I had a mass, sort of a big growth in my stomach. In fact, when I went to see the GP, the first question he asked me, are you sure you're not pregnant? Because it was so big. It was upsetting initially because I thought, why would I be pregnant unless I'm the Virgin Mary? But it was such a big tumor, and that was the first sign that something was wrong. And when it was that time of the month, girls go through that time of the month, mine was severe, that it would go on for like 8-10 days, and I became very pale. So those were the kind of symptoms I used to have.
Teenagers have to deal with puberty, body image concerns, and identity formation. As with Dr. Nkuli, she had to deal with that while battling cancer.
When you're 14, you care about looking good, pretty boys and all of that. You become sort of self-aware at that time. And for me, it became very difficult as a teenager, undergoing chemotherapy, you're losing hair, you're not so pretty. Most of the time I used to wear a hat, and it just affects your body in so many ways. So it was a tough thing to go through as a young child.
Side effects of chemotherapy are unwanted things that happen as a direct result of taking the drug. But fortunately for Dr. Buikutso, her body reacted well to chemotherapy.
Fortunately for me is that in the end it worked. So as sick as I was during the time, as unwell as I felt, at the end of the day we got the desired results, and the tumor shrunk actually. So I had a big tummy, then it went and became a small sort of size, little golf-sized ball, which they could remove via surgery.
The period of illness with cancer in her early teenage years cemented her determination to focus on the prevention of the disease and promoting health in vulnerable communities, especially children.
So all of us children who are survivors of cancer used to come together to motivate other children, go to the chalk houses, speak to the children, do workshops with them. And then as I've grown older, also in my profession, I've joined chalk in other ways to raise awareness, whether it's talking about it to different forums to raise awareness. I'm currently a member of the EXCO for the Cancer Alliance, and that organization certainly it brings NGOs together to advocate for cancer awareness and treatment. So that's my involvement with children with cancer and cancer as a whole.
All right, so to unpack this notion of childhood cancer, it's a great pleasure to welcome our two special guests. First up is Professor Janet Poole, who is head of pediatric hematology oncology at Charlotte Maxeke Johannesburg Academic Hospital. Welcome to Health Talk again, Prof.
Thank you.
Right. And of course, we also have Professor Michael Herbst, who's a health specialist at the Cancer Association of South Africa, or simply Cancer. And welcome to Health Talk again.
Thank you very much for having me.
All right. So we're talking childhood cancers, and the common message that seems to be coming out is how rare they are. How common or how rare are they, Prof?
They are rare.
Right.
The incidence is 1 in 500 children, or 1 in 600, or if you like the statistics, it's 150 per million, more or less.
Yeah.
Some areas of the world it's slightly less, some areas it's slightly more.
Right.
So compared to adult cancer, it's a drop in the ocean.
It's very, very rare. Yeah.
It's rare.
Yeah.
But the point about childhood cancer is that the survival rate or the cure rate is far higher than that of adult cancer. Yes.
From a cancer perspective, I mean, what you obviously deal with a lot with people who have children with cancers and so on. What sense do you get of how rare or common the condition is?
You know, I just want to add, even though it may be rare, the impact is always great.
Right.
And I must really say to you also, the impact on us as staff is always great, because there's such a lot of emotion that goes through the whole of the family who are affected.
I tell you what,
and one cannot but pick it up.
Correct. Yeah.
But it is rare. Yes, it is rare. We don't get people coming in every day to tell us that a child has been diagnosed.
Right.
But
you see mainly adult,
mostly adults,
people that are affected by cancers. All right. So let's come back to then, Prof, the common types of childhood cancers that we have.
So the most common cancer, as we talked about a few weeks ago, is childhood leukemia.
Right.
And especially the one specific type, which is acute lymphoblastic leukemia.
Right.
So leukemia in general accounts for about 1/3 of all childhood cancers.
Right.
And then the second most common cancer, unfortunately, are brain tumors, tumors of the brain, which sadly do not always have a good prognosis.
Right.
But that is the second most common childhood cancer.
Mm-hmm.
And then we are looking at some of the embryonal tumors, which are tumors that look like the tissue that was in the fetus, and lymphomas, and then quite a lot of other rarer cancers, like bone tumors, and as Dr. Pukutso has said, germ cell tumors, which are quite a rare occurrence, but do occur in children.
They do occur. So when you talk about children, by the way, in this instance, what sort of age range are we talking about?
We're talking up, the official incidence rate is up until the age of 15.
Right.
Although we can treat children, we consider any childhood cancer to be probably up until the age of 16.
Right.
And then you're also talking about adolescents and young adults, and that's a very neglected group between the ages of 14 and 21, which they don't sometimes they don't fall into the adult side and they don't fall into the children's side, and they're going through a lot of changes in their lives. So that group is a very difficult group to diagnose and treat.
Right. Perhaps let's talk about awareness around. I mean, I suppose the reason we're doing this show is to raise awareness on conditions like this. I suppose also around the fact that this is September and Childhood Cancer Awareness Month. The people's attitudes and knowledge, and are there any myths and stigmas around the notion of childhood cancers?
I think people do not know enough about it.
Yeah.
But my own personal view is when we talk to people, and we mustn't concentrate too much on the very specific signs and symptoms.
Right.
Because it very often scares people.
Yes.
When they see a bruise on a child, they may become apprehensive, and all of a sudden, my child may have cancer, may have leukemia, whatever the case may be.
Right.
For me, it is important to say to people, as far as yourself is concerned, if you know your body and there's something different or changed today than it was yesterday or last week, have it seen to. And my message to parents will also be, know your children And if you see any unusual change or something that's different today than it was yesterday or last week, have it seen to, without really making people scared of every bruise and every bump.
Sure.
But it is important that we do tell them about some of the very important signs and symptoms. And if there's somebody that's very good at it, it's Prof. Poole with a Sincilian.
Well, let's talk about that, because you often see these so-called warning signs without necessarily raising anxiety levels around there. Should people be looking out for specific signs?
So there's no specific sign that says this is cancer. So there are warning signs that the child may have a cancer, but then they may have something else that's completely innocuous. But the important thing is to have, if something continues for a period of 2 or 3 weeks, doesn't get better, then it's good to have it seen to by a health worker, either a doctor or a clinic or something like that, so that they can examine the child. That's the most important thing, and then see, is there anything to worry about or is there nothing to worry about. But the warning signs are there to guide the public and also the doctors as to what they should be looking out for in terms of childhood cancer.
So the clear message is, it doesn't matter what it is. If it's something that wasn't there the day or two before and you're worried about it, take the child to a healthcare
professional. And it lasts for a period of time.
I mean, for instance, let's just take brain tumors, for instance. I mean, many children vomit, it's one of the things that happens, The child eats something or whatever, they have vomits. But if this vomiting occurs like first thing in the morning and it's associated with a headache, and this happens for a period of weeks, then there needs to be a little bit of warning, kind of a bell ringing, This could be something,
Not, and we're not necessarily saying it's cancer, because not all vomiting is cancer.
Yes, that's right, And the same with glands in the neck. Many children have lymph nodes in the neck, because it's part of the immune system. You get tonsillitis, your glands go up. When you get better, they go down again. But it's those glands that just don't go away, that get bigger and that sort of thing.
But the important thing is, if the child is taken to a healthcare professional in time, there's a better chance that there'll be cure.
Absolutely.
All right. On that note, we go for a quick break. When we come back, we'll try and understand the impact and perhaps talk a little bit about some of the risk factors for childhood cancers. Please stay with us.
We probe.
His bone crushed on 3 places, so he said, well, we're going to have to amputate. And I was like, what?
We confront.
This young girl was abducted when she was 16. She was sold off by her older sister. Now, in grade 11, she has 3 children.
And we expose. Catch Special Assignment every Sunday at 9:30 right here on SABC News Channel.
Is he facing conspiracy? What is the nature of the corruption charges that he faces? But if it's a blatant kind of corruption case, he faces a potential 15 years in prison. And lest we forget, his father is in the dock in a few weeks' time, also facing corruption charges. So those parallels between father and son and the regime change in South Africa and what's happening with our courts at the moment will be something that is profoundly interesting, I think, to all South Africans.
Where am I going to sleep now? What about my kids?
There is bribe involved,
because we are not aware that they will come today.
People are being evicted about 2 months ago in May. We served the first court order. This is private property.
They came to us with a truck that has no water.
How do we build these shacks in a way that we don't have a fire spread when we have a fire incident?
Welcome back. We're talking childhood cancers with our guests, Professor Janet Poo, who's the head of pediatric hematology oncology at Charlotte Maxeke Academic Hospital, and also Professor Michael Herbst, health consultant at Cancer. And we're now joined by another special guest, Ntati Blose. Ntati is mother of a child, not a child, I mean her name is Mbali, who was diagnosed a couple of years ago with severe aplastic anemia. She's going to share her story with us. But before we go to Ntati, Prof, who is more likely to get childhood cancers? Do we know?
So fewer than 5% of childhood cancers are actually related to genetics.
Right.
There are certain genetic inherited syndromes, for instance, like Down syndrome, that are at higher risk for developing leukemia. There's some other syndromes that have a higher risk of certain cancers. And then we have some genetic cancers which are passed down, or the genes are passed down, which one of them is inherited retinoblastoma, which is a cancer of the lining of the eye. Right. But fewer than 5% can actually be traced back to being genetic or inherited.
And the rest?
And most of the cancers in children, in fact all of them, are mostly due to a spontaneous mutation or abnormality in the genes that influence cell growth.
And we don't know the reason for the trigger.
And we don't know the reason for the trigger.
Okay.
There's been millions spent overseas on trying to ascertain whether something or other has a higher risk, and we have very, very little to show for it as a direct cause.
Right, right. So cancer, as we said earlier, can have a devastating effect, you know, not only on the sufferer, but the family. So let's talk to a mother of a child who didn't necessarily have cancer, but had a condition called, Ntati?
She has a severe aplastic anemia.
Right. Tell us about it. When was she diagnosed?
She was diagnosed when she was 10 April 2010.
Right.
Yes.
Okay. Before that, let's just ask, Prof. Now, we know that severe aplastic anemia is not necessarily related to, or is regarded as a cancer itself, but nevertheless, it's a very rare disease.
Yes, it is rare. It's a failure of the bone marrow. A bone marrow which produces the blood cells becomes empty.
Okay.
Okay.
Right.
And we don't always know what the cause is. Yeah. Sometimes it may be related to certain viruses, but we just do not know. And sometimes to some drugs, certain drugs and certain toxins. Yeah. But in the majority of children who have severe aplastic anemia, we don't actually, it's called idiopathic, or we don't know what the cause is.
Or the idiots don't know the pathology.
Yes.
Well, let's come back to you then, ma'am. So what happened around the time that your child was diagnosed?
When she was diagnosed, she was an active child at home.
Right.
And then she started saying, "Mom, I'm tired, I'm tired." And then we took her to the doctor, and they said she doesn't have blood.
Yeah.
In my mind, I thought she was having leukemia because there were kids that I taught whilst I was a teacher who had leukemia.
Right.
But then we took her, the doctor also referred us to Bara, oncologist, Ward 43.
Yeah.
They did some tests. That's where they found out that she has a severe aplastic anemia.
Right.
And then she started to get blood every week and platelets. a unit of blood every week, every Thursday, and a unit of platelets. They said to us her bone marrow doesn't produce enough red cells. And her white cells also went down. So if she didn't have enough platelets in her body, she will start bleeding. She was bleeding. Now and then we'll rush to the hospital at night. She's bleeding. That was what she was living with.
Bleeding from the nose?
Yes, and menstruation also. She started when she was 10. It was very hard on her at the age of 10.
Right.
With that menstruation, we used to use the Pampers as a pad, and it was so difficult for her as a child. But that was she would take out such big clots, you know. And then
at the age of 10.
At the age of 10,
right.
It was very difficult.
Yeah.
But now, through God, she's much better now.
And how did she interact with other children at school? What was the attitude of the other children towards her?
Fortunately, at primary school, the teachers were very supportive. A minute when they see that she was bleeding, they will call me quickly. They will take care of her and take her to the sick bay, and then I'll come fetch her and take her to the hospital. And again, at high school, where she studied from grade 8 up to grade 12, they were also very supportive. When she says something, she will just tell the teachers that today I'm not feeling well, or now there's something that is happening. They will just surround her, tell the boys or whoever, the kids know in the class that if she says she's not feeling well, the girls must be around her just to make sure that maybe she didn't mess her up. Because her problem now, it was menstruation. It would come like I don't know what. Yes.
What about bruising?
And bruising also. She couldn't play. But you know, kids are kids. She ended up playing netball at high school because she was playing at primary, and then she stopped, but she continued at high school. I don't know how, but she should get the bruises, but not so bad. But she would play because she needed to play as a child, as a kid.
It was important for her to play as well. I mean, like any other children. And what did it mean for you as a parent?
At first, it was difficult.
Right.
But as time goes on, with the help of the doctors from Bara, with the support from the teachers at her schools, with the support from the family, support from our local church, everything went smoothly. You know, if you have support, I used to leave my house at 7 o'clock in the morning and go to hospital and stay with Mbali up to 8 in the evening. Because of the love and support of the family, who will take care of the other of the kids, my kids at home. That helped a lot, because even the doctors will say, if you are with your child at the hospital, that helps a lot if you are there most of the time. So most of my time since 2010 up until 2014, I spent 99% of my time at the hospital.
And how far are we from Mbali being completely cured?
Last week we went for a checkup on Thursday. They said her white cells now are 10. Her red cells, it's something like 18 or 19. And platelets, it's 138. So Dr. Kita said she's almost there. Yes.
Perhaps just a final word from you. I mean, the impact that rare diseases like cancer have on families, your experience?
Well, you know, of course it has a major impact on a father and a mother, but it also has an impact on siblings, because it may cause a little bit of anxiety with them, sometimes a fear, because my sister or my brother has it, maybe I could also have it. There could also be maybe a little bit of jealousy because somebody in the family is getting more attention than everybody else. So it has a general impact, but if managed well, families do wonderfully well.
Like in the case of Ntati.
Absolutely.
Well, Ntati, thank you so much for sharing your story with us, and we can only wish you well for both you and Bali and the entire family.
Thank you very much.
All right, now before we go on a break, we have a few tweets that I just would like to go through. If I can just get them up on the screen as soon as possible. And I think we have about 3 or so. And let's hear what people say about cancer. Dee says, September is Childhood Cancer Awareness Month. I'm proud to say I'm a cancer survivor, hashtag childhood cancer. And Stephanie says, at 48, I am a 40-year survivor of childhood cancer. I've been gold for a long time, and I'm almost golden to boot. Join me this day, every day, on behalf of kids, teens, and young adults, all of whom are vulnerable to childhood cancers. And EM says, today is the start of Childhood Cancer and Lymphoma Awareness Month. I can't believe that 4 years after my fight with pediatric lymphoma, I'm on my way to becoming a pediatric oncology nurse to help other kids fight their fight with cancer. Wow. All right, okay, so time for a quick break. When we come back, we'll continue our story on childhood cancer, and this time look at treatment and support. Please stay with us.
Life can throw all sorts of surprises at you, often when you least expect it. Sorry, Mom. That's why it's important to have medical cover. Me? I didn't want just any medical scheme. I wanted a scheme that I could rely on, that I could talk to at any time, that I could afford. I didn't just get medical aid. I got medical paid.
Hey, amakazi asipulele since kusucceeded as Fatimbawula like yabanda le goal, and then sesize decide ukuthi sivele sibase umlilo khona sokhona nokufudumala kusebenzeki na kahle.
Police killers are not coming from the sky. They are actually coming from the communities where we are. So it cannot be correct.
We regret what has happened because the strike affects everyone. So is electricity. Electricity also affects everyone. It's a community problem.
We are owing ESCOM. Currently, we could not reconcile the bill, what they bill us, with theirs. We could not agree.
Young people make up the majority of the people in this country. So why is it that the job market is filled with old people?
We also need someone who can help us with everything. Job opportunities are things that could do.
High levels of violent behavior in our schools, learners physically attacking other learners, learners physically attacking teachers, and teachers attacking learners.
The laws that are governing health today will all have to be amended and be changed. Nothing is going to stay the way it is now.
Dose of entertainment news. Watch Trends Saturday at 12 p.m.
Welcome back. If you just joined us, we're having a conversation on childhood cancers with our guest, Professor Janet Poo, Head of Pediatric Hematology and Oncology at Charlotte Macleod Johannesburg Academic Hospital, Professor Michael Herbst, Health Specialist at Cancer Association of South Africa, and we're now joined by Taryn Seegers, who's Communication Coordinator at CHOC. Welcome to Health Talk.
Thank you so much.
Well, we're going to come back to you and because we want to learn more about what CHOC does and perhaps tell people why we're wearing all of these golden ribbons. But before that, Prof, let's start talking about treatment options and the principles around treatment for childhood cancers.
So the majority of childhood cancers are chemosensitive. So the mainstay of all the childhood cancers is chemotherapy. to a greater or lesser extent. So, for example, leukemia is almost entirely chemotherapy. For brain tumors, the neurosurgeon and the radiation oncologists play a larger role. The surgery is important to remove the tumor. And so it all depends on the kind of cancer it is as to how much of each modality is used. An example of where all three modalities are used is a kidney cancer called Wilms tumor, which is a fairly common cancer in South Africa. It's very, very curable and treatable. And so what happens is we give chemotherapy initially to shrink the tumor, and then we perform surgery to remove the kidney. And then depending on the stage, the child will continue with radiation and some more chemotherapy, or just chemotherapy alone. So it's a cooperation between a team of people. So it's not only the pediatric oncologist, it's also the pediatric surgeon, the neurosurgeon, orthopedic surgeons in the case of bone tumors, and the radiation oncologists as well.
And of course the families and support groups and so on. But just before we talk about support, the outcomes of treatment.
So also it all depends on the type of cancer. The overall cure rate is around 70 to 80%. In South Africa it's a little bit lower because of some of the late stages of the solid tumors that present. However, for instance, leukemia, acute lymphoblastic leukemia, has an 80 to 85% cure rate. Wilms tumor has a 90% cure rate. Retinoblastoma, if it's diagnosed really early, has almost 100% cure rate. But it all depends on the stage. So if a child with retinoblastoma comes in stage 3 or stage 4, then the survival rate drops right down to 40% or 50%. So it all depends on when they come to the hospital.
Perhaps we said earlier, I mean, children undergoing treatment need a lot of support, not only those undergoing treatment, but in fact the families around them. Tell us from your perspective now how important this support is.
I think we heard from the mother that joined us earlier, the important role that she played. But we must now remember that a lot of people live far away from the major treatment centers, some from rural and far rural areas. And it's not always possible for them to join their children to come to a treatment center. And this is a place where the Cancer Association of South Africa plays a major role. We have what we call children's lodges, but it's actually a misnomer because they're not lodges for children. They're actually lodges for the parents or for the caregiver, very often a sibling, who will come. But the importance is, while the child is in hospital being treated, that there is somebody there that will on a daily basis be around and will be able to visit the child whenever possible. And that is so important, the support for that child who's undergoing treatment, to have a family member or somebody that is well known to them. And I don't think we can ever overemphasize the importance of support, and especially of loved ones supporting the child.
Let's hear it from Taryn. Taryn, your view on support. Perhaps before that, tell us about CHOC and what you do and why it is that we're wearing these ribbons.
Okay, so CHOC is an incredible organization. The only organization within South Africa that offers comprehensive support for the children going through the cancer as well as their families. It's not only the child that gets diagnosed, the family goes through everything as well. The ribbons are beautiful ribbons, and it's all in support of Childhood Cancer Awareness Month. It is the symbol for childhood cancer. And basically we're just calling on South Africa just to raise this awareness. Why is it important to know these early warning signs? Just what are the myths, what are the stigmas that go with it? And just the money that's raised with these ribbons, that goes straight into awareness, advocacy, accommodation, transport, all of the things that CHOC does on a daily basis for these children.
Well, interesting, you talk about myths What are some of those that you pick up, during your daily interactions with people?
There's so many. Some people don't agree with the treatment. Some people don't feel like their child deserves to have cancer because it's something that they've done in their past. Or they just don't understand it. And it is so important just to go get a professional to help you, get the proper treatment that's needed, so that the earlier we're able to diagnose it, the better the survival rate is.
And you don't come across stigmas and, people being sidelined and that sort of thing?
Most definitely. It all comes down to cultural beliefs, and I mean, we're working with the Departments of Health and traditional organizations as well, just to educate them and to do it. We've trained over 20,000 people already, just on all these early warning signs, the myths, the stigmas that go with childhood cancer.
And I suppose that's quite important, having heard the fact that we, South Africa, seem to have a slightly lower success at treatment simply because people present late.
They present late because there's also an access problem, we must remember.
Yes.
That we don't have access to healthcare, though that we would really like to see it happen. And we are only hoping and trusting that NHI will come into operation and it will be a great success, that people will have earlier access so that especially our children can be seen earlier, can be diagnosed earlier, and can be treated earlier. And then we will equal statistics anywhere in the world.
Talk about access, Prof. Are there specialized centers around the country that, deal only with childhood cancer?
Yes, I mean, because it's such a rare disease and such a specialized area. We have centres in the main cities and the main teaching hospitals in South Africa. And the issue is a child who lives in a rural area. The referral pattern is very, very poor. Okay, it's laborious. They get referred from the clinic to the local hospital, to a secondary hospital, and this can take a long time, because of transport, because they don't have space at the hospital, and so on and so forth. And they often go backwards and forwards, and it really is a laborious way of getting to a main centre. Once they're in the main centre, then we go ahead and we diagnose and we treat. And we never have a waiting list in childhood cancer because we know how important it is. So if somebody phones up and says, I've got a child with suspected cancer, whatever, we will say, come tomorrow, come the next day, or come today, even if it's an emergency. We will never say, no, well, we don't have an appointment till next week or next month or next year. But once they get there, then it's fine. But the whole referral process is very, very difficult.
Right. So I mean, obviously it brings us to how important it is then that those that have traveled far to get to the center are supported. I'm going to ask you to take us through what it is that CHOC does to support those. But before that, we're going to go for a break. I'll ask you that after a quick break. But for now, we have a few tweets that we'd just like to go over, if I can just get them here. Makaila says, September is Childhood Cancer Awareness Month. I encourage everyone to research the lack of funding our children receive. 1 in 5 children are diagnosed with cancer. It can happen to any of our families. Learn the facts and spread awareness. Danielle says only 4% of cancer research goes toward childhood cancer. Fewer than 10 drugs have been developed since 1980 for childhood cancers. We need to be better. Cancer is the #1 cause of death in children. And the Rock in R says it can happen to anyone. It drops on you out of nowhere. Reese was a perfectly healthy child with no other illness throughout his life, apart from chicken pox and some coughs and colds. And then at 10 years old, cancer. 9 months later, we had lost him. Shame. All right, so time for another quick break. When we come back, we continue our story on support and treatment for childhood cancer. Please stay with us.
township under siege, roads blockaded, and the atmosphere here remains tense. Residents want their houses damaged by the storms repaired.
Raids are coming. Who's going to repair my furniture?
Police remain vigilant.
We may never have sufficient members, but the members that we have, we are comfortable with them. We are in a position to deal with the situation.
From us also as councillors, we lack information as it's not cascaded to us.
We are losing the best of kids. People that fathers or pastors that comes from a church.
No taxi, nothing. We were not notified. I get to town, there's nothing. I think
The Orange River is South Africa's major river. It rises in the Drakensberg in Lesotho, known as the Senqu River. It flows through Free State via Van der Kloof Dam, Eastern Cape into Gariep Dam, Northern Cape and Richterveld Transfrontier Park, which is part of Namibia. Orange River is 2,090 kilometers long. It finally flows into the Atlantic Ocean at Alexander Bay.
Okay, welcome back. We're talking treatment and support for childhood cancers with our special guests, Professor Janet Poo, Head of Pediatric Hematology Oncology at Charlotte Maxeke Academic Hospital, Professor Michael Herbst, Health Specialist at Cancer, Taryn Seegers, Communication Coordinator at CHOC. Prof, now during treatment, are there any do's and don'ts that families should consider and or that you advise families? Let's take, for instance, the issue of nutrition.
So we would like the child to have a normal, healthy diet, right, to have enough energy, so to have enough carbohydrates and that sort of thing, and enough protein, because during cancer treatment the body loses muscle mass and loses protein in terms of the activity of the cancer, right, and the treatment. But in addition to that, because the children are immune suppressed, we prefer them not to have certain kinds of foods because of the risk of infection. And so, for example, we advocate that all food should be freshly prepared and cooked, and not to have takeaways which may be sitting there under a light for goodness knows how long. And especially foods that are prone to having have bacteria grow in them when the temperature is not quite right. And a good example of this is chicken. So chicken that's been cooked and then left, in a takeaway place for a few hours on end is not a good thing for a child whose immune system is poorly. And they shouldn't have anything that's not cooked. So things like biltong and that sort of thing, they shouldn't eat, and dried fruit, and if they have fruit, it should be peeled or washed very carefully, and so on and forth. But otherwise, there's no specific food that we advocate they should have. But apart from the restrictions for their immunity.
All right. Taryn, let's get back to you. Before the break, I had asked you to just, comment on the issue that, children that are undergoing treatment, often those that come from, far-flung, areas, need some sort of support, for instance, you know, it's important that they stay for the duration of the time that they're required for the treatment. How do you support them?
Well, CHOC have amazing support structure. We start from the beginning with psychosocial support. So we've got social workers in the hospitals. They're there from diagnosis. And these social workers walk a very close road with our patients. We have accommodation facilities. We've got 12 at the moment nationwide. We offer transport facilities, so to and from the hospital, or assist as well when they go home, that they have money to come back for treatment, ensuring that they come back and they get that treatment that they need. And we also do practical support, food parcels, care bags, clothing, items that they may need or don't have time to go home and fetch if they have to stay or if they're coming from far. Then we also have volunteering and all of that stuff as well.
Yeah. Prof, before I forget, during the break, you and I spoke about some other issue. Continue on the issue of the impact. Now,
and the long-term impact,
yes, of childhood cancer sufferers.
You know, our experience is that one of the major long-term effects of childhood cancer survivors is early adulthood and later when they want to get insurance, for instance. They are penalized, very often with a double premium, or very often they are refused any form of insurance. And I think it is so unfair, but yet people just say, sorry, I can quote you a case. Somebody who was diagnosed about 10, 15 years earlier with a skin cancer that is absolutely curable. And she was hit with a double premium in her early adult life. And Prof. Poole made mention earlier just now, and maybe she wants to just mention.
Is there any basis for that, Prof? Yeah?
No, I don't think there is. I mean, we had a young boy who had been diagnosed with leukemia and was 10 years off treatment, so we consider that a cure. And he was unable to get a pilot's license in case he relapsed in the air, you know, kind of thing. And you know, which is it's really ignorance on the part of the insurers that you have to educate them, and so eventually, after many reports and letters and case studies and everything, we convinced them that there was no danger, that he would be a danger to himself or to whoever he was flying.
Unfortunately, they were granted. He was granted the license.
And he was able to do his pilot's license.
Unbelievable. Before we run out of time, Taryn, so of course you're about raising awareness. Are there any special activities that you're perhaps undertaking during this month?
September is full of exciting activities throughout all of our regions. We've got golf days happening in Western Cape at the end of the month. We've got a Run for Hope event happening this Sunday with our Joburg region. All of the events can be found on our website, as well as really nice September merchandise which can be purchased. And of course the gold ribbon, we want everybody to proudly wear it throughout September. Share your photos, send us pictures, we'd really appreciate that.
So where do people get the ribbons? I mean,
from our
make
website.
Yourself? Yeah?
No, from our website. They're proudly CHOC ribbons. So www.choc.org.za.
Okay, all right. Let me get each of you 30 seconds, just your final thoughts on childhood cancer. Prof?
Childhood cancer is a devastating diagnosis for parents, but it does not, in the majority of cases, mean a death sentence. And there is hope, and certainly we are making good strides in the treatment.
There is hope indeed. Prof?
Children are our future. Without them, where will we be? People, please support childhood cancer awareness and support every single childhood cancer event so that we can look after our children in South Africa.
Taryn?
Well, it's a disease that's not going anywhere anytime soon. So read up about it, know the warning signs, learn everything you possibly can, and seek help from the professionals. They know what they're doing.
Well, on that wonderful note, I can't thank you enough. Thank you so much, Professor Janet Poole, Head of Pediatric Hematology Oncology at Charlotte Maxeke Hospital, Professor Michael Herbst, Health Specialist from Cancer, and of course Taryn Seegers, who's the Communication Manager at CHOC. And thank you so much for your time. And of course earlier we had Ntati Blose, mother of Mbali, who had that rare condition called severe aplastic anemia. And that's how we come to the end of our show today. And thank you so much for watching, staying with us, and thank you so much for the tweets as well. So we see you again next week, same time. And until then, please do take care.